All right. Hello, everybody. Thank you all so much for joining. My name is Mia. I am one of the field lead organizers working to reelect Congresswoman Alexandria Ocasio-Cortez. And I am so thrilled to kick off this call on an incredibly important topic. So let's go ahead and get started. I just want to say that I am so excited to have you all here tonight in the middle of what feels like yet another pivotal and unprecedented moment in our country's history. We've been having a lot of those lately. But I do want to thank you all for tuning in at a time when I know for many of us, the current events have really had a direct impact on ourselves and our well being and our communities, and our energy is so limited right now. So I want to just acknowledge that and thank you. So, that being said, I know we hear this all the time, but so many of these issues that we're talking about are inextricably linked, right? So, police are out brutalizing protesters in the streets. And in the meantime, we have to crowdfund to raise money for the medical costs of those victims. We know that our Black and Brown and queer and immigrant brothers and sisters are disproportionately affected by those things and are not getting the care that they deserve. And our profit driven system really fend for themselves and to make choices that they should never have to make. So, coronavirus, we all remember, this little bit of ancient history. It feels like it was forever ago, at least for me. So much has happened since the pandemic began. But the reality is that 42 million Americans, which is more than a quarter of our entire workforce, by the way, have claimed unemployment during just this pandemic alone, and that number continues to grow. So for most people, we know that healthcare is tied to employment, and we all also know that this is kind of a long time failing of our very complicated, specific history with the U.S. healthcare system. So now, in this pandemic, with tens of millions of people without jobs, without access to basic care, with no protections, being violently repressed for speaking out against the embedded racial injustices in our society, these kind of connected factors, I'm sure, are not lost on any of us. So, to speak further on this, I'm extremely happy to have with us somebody whose entire life work has embodied these exact connections. So you may know Dr. Abdul El-Sayed from the 2018 governor's race in Michigan, where he ran on a bold, progressive platform of universal healthcare, tuition-free higher education, clean water for all. But he's also an internationally renowned epidemiologist, physician, and public health expert. So he has dedicated his career to fighting the exact injustices that we are witnessing today, that are happening now. And yeah, for that reason, I am so happy to introduce you guys to Dr. Abdul El-Sayed.
Mia, thank you so much. I'm honored and privileged to be with you today. And these are challenging circumstances, and I want to speak specifically to the fact that it feels like just yesterday, but 2 weeks ago we saw a video of a man get lynched by police, a Black man be lynched by police. His name is George Floyd, and we have to remember that this kind of police brutality, this kind of violence, cannot go unchecked. And since we have seen brave people, sisters and brothers, allies, stand up against police brutality, against systemic racism, and against the brutalization of Black men and women by police. And I want to acknowledge that that has to be the space from which we speak today, because this does feel like a seismic moment in our country. And I hope that it is a moment from which we can birth a new reality where people know that they have the ability to walk free in the streets. And I've spoken a lot to friends of mine who are protesters, many of whom are white. They talk about the courage that it takes to go out in the streets to stand up for justice. And I deeply appreciate that courage. But one of the things I want to remember is that for a lot of our Black sisters and brothers, that's the courage you need to just go out in the street outside of a protest. because we've watched how race can be weaponized against Black people in this country. And so you might ask, why are we talking about Medicare for all in the context of a conversation publicly and nationally that is rightly focused on race? Well, it's because all of these things are connected, as Mia talked about. In this country, we know that even before the massive surge in unemployment that Mia talked about, that 30 million Americans went without health care. Black Americans were 50% more likely to be those without health insurance in this country. And so public health and public insurance coverage is a racial justice issue. And that came to the fore in the context of COVID-19. COVID-19 killed disproportionately Black and brown people in this country. And no communities were hit worse than Black folks and Indigenous folks across the country. In fact, in the district that AOC represents, it was the hardest hit district by coronavirus. And these disparities tell us something about the insecurity and the failure of our healthcare system and our broader public health system. And I want to speak to how Medicare for All would help solve that and why that has a disproportionate impact on Black communities. I just want to start from the beginning. COVID-19 as a pandemic was preventable, right? The virus of COVID-19, that was around. But the difference between a virus and a pandemic is what we as people do to prepare for it. And I think of pandemics like fires, right? You can put a fire out when it's small. You know, if you get a fire in your toaster, you put it out immediately. In fact, we all have mandated fire alarms in our homes to put them out. We have mandated fire stations to make sure that if that fire were to spread into a home, it doesn't spread to other homes. The equivalent of fire alarms and fire stations for us are our public health departments and our CDC that have been systematically underfunded because there is no incentive in our current healthcare system to prevent disease in the first place. Why? Because we've allowed major corporations, be they healthcare providers, doctors and hospitals, or health payers, insurance companies, to dominate the market, to focus on the exchange of money between them. And in our current healthcare system, right, if you're lucky enough to have health insurance, you have one of 7,000 health insurers that you probably get through your employer. But if not, then you potentially purchase them on the exchanges, or you're on a government health plan like Medicaid or Medicare, right? Those folks provide you health insurance. And then if you get sick or if you just want a well visit, you go see a doctor. Now, the exchange of money happens between your insurer and your doctor. I want you to think about something. If I were to go to a store and I said, I want to buy this phone, right? I pay Apple for my iPhone, and the money goes from me, the consumer, to Apple, the provider. But if you think about it for a second, right? This iPhone was the product. It was the reason why money was transferred. In our current healthcare system, money gets transferred if I get sick between an insurance provider and a healthcare provider. I'm not actually the customer because I'm not paying for the good. I'm the product. I was the reason why money was transacted. And when we talk about the failures of our healthcare system, it's that fact that we are treated as products rather than as consumers, rather than as people, that has made the system so broken. What does Medicare for All do? Medicare for All comes in and says, no more of this insurance industry, which costs us far more, whose CEOs make tens of millions of dollars a year, who create redundancy in the healthcare system, which increases the overall cost for all of us. Instead of that, we have one national health provider, right, Medicare, that has expanded to eliminate co-pays, the money that you pay when you get healthcare, deductibles, the money that you have to pay before your insurance kicks in, and premiums, the stuff that we pay biweekly or monthly to have our healthcare. What does that do? Rather than having multiple payers and multiple providers, we have one payer that eliminates all that overhead. No more paying a CEO $15 million a year. No more paying for the advertising costs of those insurers. Instead, you've got one payer, right? One insurer, and as many providers as you want, right? And so you can go to any doctor you want because you have coverage. If you lose your health care, you still have coverage. If you get divorced, you still have coverage. If you turn 26 and get bounced off your parents' insurance, still have coverage. If something were to happen at your workplace and they cut your insurance or they move you onto a junk plan, that doesn't exist because you have coverage, because you're covered by the single payer system, which is Medicare. All of us are on it, nobody out. That is the ideal we're striving for. Now, how does this have to do with racial justice? Well, we talked about COVID-19. Who were the folks who were most likely to not have healthcare coverage in the first place in those moments where people were first getting sick and throughout? Black folks and brown folks. who are the people who are most likely to have to go out into the economy to work, usually at jobs that don't necessarily have great benefits? Black and brown people. Who are the folks who had to go to the hospitals that were being most inundated by COVID-19? Black and brown folks, right? And all of this connects, right? And so Medicare for All allows us to build a system where everybody has health insurance. Nobody has to worry about out-of-pocket costs. Anybody can go to any doctor that they want, go to any hospital that they want. And the healthcare system overall is less expensive because we're not paying for the redundant overhead that health insurance offers us. We're not paying big CEO salaries. And then I want to get to a final point. One of the things that we saw is that all of us had to go into our homes during COVID-19 because we didn't want the healthcare system to get overwhelmed. We had to, quote unquote, flatten the curve, right? We had to social distance. We had to shut down everything. Everybody had to go inside. Why was that the case? Because our healthcare system is not built for surge capacity. It's built to make money. And so we watched as our hospitals and doctors struggled without the basic protective goods that they needed to be able to take care of us. We watched as hospitals got overrun because they are taught under this business model, this for-profit model of healthcare. They're taught that they have to eliminate their overheads. They have to reduce the number of rooms and reduce the number of ventilators and reduce the overall stock of PPE because, of course, you don't need those things. You don't make money off of them. And even worse than that, because there was a pandemic coming, they had to cancel their most lucrative services, right? These services, the procedures, elective procedures that they make most of their money on. So you watched all of the hospitals struggle under the weight of COVID-19 while also having to fight bankruptcy because they didn't have the money flow coming in. And so Medicare for All doesn't just protect us, give us insurance that is completely portable, that is completely affordable, that does not matter what your employment status or your marital status or your age is, but it also protects our healthcare system so that it's there when we need it. Rather than having to rely on elective procedures and negotiations between insurance companies and hospitals, right? We know that Medicare will be there for our hospitals being able to offer them surge capacity because it buys us out of this for-profit model that tells hospitals that the only thing that matters is how much money they can make off of us, rather than telling us, rather than whether or not they can actually care for us. And so this is the opportunity that we have in front of us. Now, make no mistake, this is going to be a big fight. And the reason I'm here today is because AOC has been leading that fight. We know that the insurance companies, they want to continue to be able to make massive profits off of us, forcing us to pay for the healthcare we already pay for in the form of a deductible, forcing us to pay massive salaries for their CEOs. We know that the hospitals want to continue to be able to profiteer off of the healthcare system as it stands. We know the pharmaceutical industry wants to continue to be able to charge us anything that they want because right now, under current law, Medicare cannot negotiate the cost of prescription drugs. And we know that the manufacturers of medical equipment want to continue to profiteer off of us too. All of these industries have already come together. In fact, they built an organization called the Partnership for America's Healthcare Future. If you watch the presidential debates, you probably saw their commercials telling us why Medicare for All was so dangerous. So it takes guts to fight for it. And AOC has been fighting for it since she began running for Congress. I got to know AOC when I ran for governor of Michigan. And she actually came to Michigan to campaign for me for a day. And the thing that struck me was that, I'll tell you this, you know who a leader is based on who they pay attention to in the room. The leaders you really want to elect and you want to follow are the people who pay attention to the folks who are in the back, not the folks with power, not the folks with money, not the folks with titles, but the folks that nobody else sees. And no matter where we went, we always had to pull Alexandria because she was always talking to some kid in the corner or a senior somewhere else, just spending time learning their story and hearing about what they were concerned with. That's the kind of leader that I know is always going to stand for the things that are right, that are true, that we need, that will fight for those seniors and those children. And AOC is that person. And so it's not just about saying the right things. A lot of people can say the right things, but it's about having the fortitude and having the leadership skills and having the willingness to stand in when there's a lot of pressure to say and do the right thing. And AOC has shown that. This conversation is going to get a lot harder. Why? Well, for just real talk, Bernie has carried the flag on Medicare for all for a while now. And the fact that he is not going to be running for president in the future says that we need flag bearers who are willing to carry this flag. And so it has never been more important to have leaders in Congress who are willing to stand up for the notion that we in our society should have healthcare for everybody, that nobody should be left out, that corporations, be they health insurers or healthcare providers, hospitals, shouldn't be able to profiteer off of us. And AOC is one of those leaders. And so my hope is that you all will do the work of getting her elected. And that's what we're here to do. The last point I want to make is that there's a concept. What does the word public mean? I want you to think about that. Like, who is part of the public? And a lot of the conversation that we've been having over the last week has been about including Black folks in the word public. Because if you think about it, they have been excluded for far too long. Public safety, right, is another term for law enforcement. But we've watched as, no matter where you go in the country, there are incidents of cops brutalizing Black folks. Because in their concept of the public, right, those Black folks aren't part of it. In fact, those are the folks they think they need to protect the rest of the public from, simply because of the color of their skin. Then you think about public health. COVID-19 disproportionately killed Black Americans. And then you think about the decisions they had to make, right? A lot of folks stuck in low-income jobs. They were deemed essential when just before that, we were trying to debate whether or not they should earn a measly $15 an hour. And you think about public health, right? Public health. Why is it that COVID-19 killed so many more Black folks in America per capita than white folks? Well, because we don't really include them in the public health. You think about public utilities. I'm sitting here 50 miles away from Flint, Michigan. I was there on Monday at a protest. Public utilities don't include Black folks either. Otherwise, the water in Flint would not have been changed by the state government to save pennies on the dollar, poisoning 9,000 kids, 100,000 adults. You think about public education and the quality of our public schools in Black communities versus white communities, not included there either. And so when we think about the work ahead of us, it is about including everybody in the term public. That's why I believe in Medicare for all, because it is one program for everyone, meaning you can't exclude people in that program. It is a program that by definition impacts, it affects, it empowers every single person. I worry about trading out Medicare for all for other ideas where you have a cobbled together quilt, right? And then who falls through the holes in the quilt? Tends to be low-income folks, tend to be Black folks, tend to be brown folks across this country. And so we have to fight for public investment that includes everybody in the forms of basic social goods that empower us all. And that vision of an America where nobody is excluded, nobody is marginalized, and everybody is empowered, everybody's included in this concept of the public, that's the America we're fighting for. And AOC is leading that fight. She will continue to lead that fight. But it's only going to happen if folks like you decide to make it happen. The thing about candidates like AOC, candidates like me, candidates like Bernie, is that we don't have powerful backers. We don't have corporations behind us. We're not making deals in back rooms with folks so that they can support us and so that we can earn all their endorsements. We rely on real people. And that means real people deciding that they are going to do the work, to make the calls, to send the texts, to engage with folks, to in other times knock the doors, and so you being here right now, that is the work. That is what allows an AOC to stand up in Congress, stand firm, and talk for the people, because the people come and talk for her. And so thank you for being here. Thank you for doing the work. Thank you for all the conversations you're going to have. And I just want to finish on a note. Some conversations you're going to have are hard. They always are. And I think one of the things I love about AOC's leadership in particular is that it is empathic. It's not just about what you believe versus what I believe. It's about why you believe what you believe. And the ability to meet somebody where they are and bring them where they need to be, that is what leadership is. And I always say that you can either win an argument or you can win the future. And it's always better to win the future. And so what you all are doing is winning the future, a future that includes Medicare for all, a future where we have ended the brutalization of Black Americans in our streets, a future where we have rethought what it means to really provide public safety rather than enforce laws that we know have excluded people for a long time, a future where everybody is included in the word public, where Black folks are valued and celebrated for what they add in our society and for who they are. That's what we're fighting for right now. Let's go win that future. So for all of you who joined us on the live stream, thank you. Really appreciate it. We are going to end the live stream now, and then I'm going to go away for 10 seconds, and we're going to come back, and we're going to talk about where all the rest of you all on the Zoom call need to go. All right? Thank you again.